You are called to a 69-year-old who is experiencing difficulty breathing at their home.
Okay, PPE is on, my scene is safe. Let's see. Number of patients is 1. NOI, MOI is dyspnea, difficulty breathing. Don't believe I need any additional resources at this time, and does not appear that I need C-spine, but I'll ask my patient. Hi, my name is Matt, I'm with the ambulance. Have you fallen or hit your head today at all?
No, I just can't catch my breath.
Okay. Well, we'll help you out with that here in just a second, okay?
Okay.
So, let's see. All right. My general impression of this patient is poor at this time. My level of consciousness appears to be A on the APPU scale, and her chief complaint is difficulty breathing. Moving on into ABCs. My airway is patent because she's speaking to me. I can see adequate ventilation because there's good rise and fall of her chest. It's equal and bilateral. I'm going to go ahead and throw a pulse oximeter on my patient. What reading do I get?
91%.
91%. Okay, I'm going to go ahead and count respirations. Okay, I got 14. What is my patient's real respiratory rate?
24.
24. And what's the quality of her respirations?
Deep. 24 deep.
Okay. I think based on this respiratory rate and O2 sat, I'm going to put my patient on a nasal cannula set to 6 liters a minute. Do I see a change in the pulse oximeter reading?
It goes up to 94%.
Okay. Does that seem to be helping you at all, ma'am?
A little bit, but I just really can't catch my breath.
Okay, we'll go ahead and just swap this over to a non-rebreather mask. We'll set that to 10 liters a minute and monitor it from there. Let's see. I'll go ahead and check this now. I got 80. What is my patient's real pulse?
Patient's actual pulse is 134.
Okay, do I see any major bleeding in my patient?
Nope.
Okay. What is the temperature, color, and condition of her skin?
Pale, cool, and clammy.
Okay. Well, it appears she's going into shock, and this is a high priority patient, so we'll transport her as soon as possible, meaning we'll get her into the ambulance now, and we'll treat for shock on the way, so we'll keep her warm with a blanket. She's already on oxygen. We'll keep her in a supine position and continue on with our assessment in the ambulance. Now we're in history taking, so are you allergic to anything?
Peanuts.
Peanuts. And are you currently taking any medications?
Yeah, I'm taking some antibiotics.
What for?
I had to have open heart surgery 2 weeks ago.
Okay. And you haven't had any peanuts today, have you?
No,
Do you have an EpiPen?
I do not.
Okay.
I've never had a severe allergic reaction.
You've never been hospitalized
Or anything like that. No.
Okay. Do you have any pertinent medical information that you would like to share with us?
I had open heart surgery 2 weeks ago. So I had a heart attack about 2 weeks ago, and they did open heart surgery, and I've been home from the hospital for a little over a week now.
Okay. What was the last thing that you had to eat or drink?
I just had a sandwich for lunch.
And do you know how long ago that was?
About 2 hours ago.
And what was going on before you called the ambulance today?
I was just watching TV. Jerry Springer reruns. He died this week.
That's horrible. Well, let's see. When did this all start?
I woke up this morning a little bit short of breath, but it was really while I was watching TV that I realized I wasn't able to catch my breath.
Okay. And is there anything that makes this difficulty breathing, worse? Does anything make it easier for you to breathe?
Yeah, I think I kind of laid back in my recliner when I was watching the show, and I think that it got really hard to breathe when I was laying down. It seems like sitting up is a little better.
Okay. Well, we've got you in the supine position now. Is that oxygen sufficient for you? Are you feeling comfortable?
Yeah, I'm feeling okay.
Okay. And let's see. Can you describe this pain to me this difficulty breathing in your own words?
Yeah, I just feel kind of like I'm drowning. I just can't catch my breath.
And on a scale of 1 to 10, how bad is this difficulty breathing?
I'd say it's a 9.
Okay. And has this come and gone? Is it, constant struggle for you to breathe?
It's constant. I'd say it's been just slowly getting worse all day.
Slowly been getting worse. And as far as when this all started, was it just out of the blue, nowhere, or did it come on gradually?
It was gradually. I mean, was when I kind of woke up this morning is when I first noticed it, but then it's just kind of gradually gotten worse throughout the day.
Okay. And it hasn't changed at all since you called the ambulance?
No, it's been pretty bad for the last 20 minutes or so.
Okay. All right, well, we can go ahead and take a look at the affected system here. So I am going to use my stethoscope to auscultate in all 6 lung fields. Do I hear anything?
You hear fluid in all the lung fields.
Fluid. All right. I'm going to expose my patient's chest and visually examine it. Do I see anything out of the ordinary?
You can see like the results of the open heart surgery, but it just looks like normal healing laparoscopic wounds.
Okay. And I'm going to palpate my patient's chest. Does she complain of any pain or anything?
There's
like
a little bit of pain, but that's been like that since the surgery.
Okay.
Nothing new today.
And nothing feels irregular to me at all while I'm palpating?
No, everything you feel seems normal.
Okay. Well, now we're back in the vital signs, so I will recheck my respiratory rate and my heart rate. Have there been any changes?
No, they're the same.
Okay. We'll take a blood pressure. I got 145 over 110. That's my patient's real pressure.
We'll say it's that same thing, 145 over 110.
I don't think I need to get any other vital signs at this point. Blood glucose seems irrelevant. Has there been any change in the quality of my patient's respirations?
Still just kind of panting, like she's trying to catch her breath.
Okay. Moving on now, I believe my field impression of this patient is that she's suffering from pulmonary edema due to the fluid buildup in her lungs, probably a byproduct of the surgery. It could either be congestive heart failure or a side effect of the surgery itself. I don't believe that there is any other intervention that I can perform, but I will call medical control, let them know that she is resting somewhat comfortably on 10 liters of O2 through a non-rebreather mask and see if there's anything else that we can do. After that, we'll go ahead and We'll reassess our vitals every 5 minutes en route to the hospital. And when we get there, we will let them know that we are inbound with a 69-year-old female who's complaining of dyspnea. She has a respiratory rate of 24 and deep. Her pulse oximeter reads 94% on 10 liters of O2 through a non-rebreather mask. She has a pulse of 134. Her blood pressure is 145 over 110. She's coming to us this morning after complaining of difficulty breathing. 9 out of 10. Was just watching TV this morning when it hit her out of nowhere. And we are done with this assessment.